Alright, I'm recording.
80%, that means between 7.8 million and 15 million New Yorkers will be affected at the end of the day. We're just trying to postpone the end of the day.
On the way, be careful.
What that number does is put a real crunch on this city's healthcare system. We're already seeing a huge crunch in terms of gowns and masks and ventilators and medical equipment, but also hospital space itself. And that's why I'm saying
Bubba, I'm recording you.
Massive conference center is now poised to become a field hospital with possibly hundreds or more beds for people to come in that are infected by the coronavirus to help to alleviate some of that space problem we're having in New York hospitals. Anna.
Heather Morris, Nataro. Everyone has to get creative here. Thank you. Joining us now is Dr. Anne Lemoine, the director at the UCLA Center for Global and Integrated Health. She is also a professor in the Department of Epidemiology at UCLA. Thank you so much, Dr. Lemoine, for being here with us. Let's start with this new authorized by the FDA we learned today. It promises results in as little as 45 minutes. How big of a deal is this?
This is an enormous achievement. We need more tests, and tests that are rapid will make a very big difference. It means that we're going to be able to triage patients much more quickly. We're going to be able to know who is infected, who needs to be isolated, who needs to have a special procedure or special care taken, not to infect others, including healthcare workers. This test is very, very important from the perspective of hospitals, but also from the epidemiologic perspective, as with the shortage of tests that are available on the market and in the hands of the health system right now. We have no idea where we stand in terms of actual number of cases.
How likely is it, though, that it will really be available starting next week?
You know, it's unknown at this point to where things stand from what I understand. But you know, the point is that there are tests that are going to be available. They're moving very, very quickly through the pipeline, and I'm certain that they will be available as soon as they possibly can get production up and running and out the door.
And the number of cases, doctor, are surging every day. Hospitals are warning about being overwhelmed. When will we know if these social distancing measures are working? When will the numbers start to level off?
Tony Fauci made very good points about this just in one of the recent press releases, which is where we are today with testing does not indicate where we are in terms of the number of people who are truly infected. We're looking with the data that we have today does not take into account the people who are asymptomatic. It doesn't take into account the people that were exposed today and that may be showing symptoms 5 days from now or 2 weeks from now. There's a very, very large difference between what we know today based on the testing, based on the availability of information, and where we actually are in the middle of this outbreak.
Doctor, please stay with me as I bring into the conversation former presidential advisor to four presidents, David Gergen. And David, the White House touted the fact that companies are really stepping up efforts to get the much-needed medical supplies to doctors and other medical workers.
Looks like you got yourself on the roof.
What more could the administration do to ensure that production steps up and there will be enough?
Oh crap!
Well, clearly the president could be working more closely
Oh,
and
my.
mobilizing companies around the country and indeed around the world. He has this authority now from the Defense Production Act. He could move in and actually be telling companies what to do. We've been hearing, after all, for week after week, that test kits will be there tomorrow. They'll be here by the end of the week and so forth. And on the front lines, as Dr. Ramon knows, but even better than that, much better than I do, things are really tough. There's a backlog in hospital after hospital here in Boston and all our major hospitals. You know, we don't have enough masks, we don't have enough ventilators, and we don't know about the tests. And one of the things I'd be curious about from Dr. Is this. Listen, we've been told for a long, long time, we need more tests, we need more tests, we need more tests. Now, lungs apparently are going to come these testing kits, but the word is going out now from various authorities, don't go to get tested. You don't need to stay home. So I don't know, Dr. Ramon, which is it now? There's confusion about this and many other questions like it.
These are very, very good questions. And I think that the issue is, it's not just the tests being available. You need to have the swabs. You need to have the reagents. You need all of the chemicals and the other pieces
Where's my
that
car?
are needed to actually make the test happen. Plus, you need the points of care ready to be able to accept the volume of people and to test people in a safe environment. So, it's a multi-pronged or a multi-stage situation that is not just you hand somebody a test and say, go for it, you're done, now you're ready to test everybody. So I think getting the tests in the pipeline is important. We saw this with Ebola, where there were many tests that came on the market, but they took time to get out into the hands of the right people and the health systems to be able to understand how to use them and to be able to deploy them in a way that made sense. And it's no different where we are now.
Well, we're hearing about more doctors getting sick due to the virus. Why is it particularly dangerous for medical workers right now? Is it even safe for people to go to the hospital if someone is sick but the symptoms are maybe manageable? Are they better off staying home?
So these are two separate questions. The first question that you asked was about healthcare workers. Why are healthcare workers getting more sick than other people? Well, they're not necessarily getting more sick than other groups, but they are getting sick and they are at risk. And it's because there is not enough personal protective equipment, what we keep talking about, this PPE. And that is the issue here. And without PPE in place for healthcare workers and for a health system on the verge of complete overload, we're literally putting these people out there. What do we say? They're going into a fight with a butter knife as opposed to a gun. It's just it's really a huge problem. Without PPE, our healthcare workers are at great risk. They're at the closest point of contact with very sick people. And while we still don't really understand how this virus affects people and when people are most contagious, it makes biological sense with other viruses. When people are highly symptomatic, which is the moment that they're going to the hospital or when they're being treated by doctors, they're most infectious. So doctors are likely getting a higher viral load. Now, that is not scientifically proven yet, but it makes biological sense to me why you would see people getting, healthcare workers getting sicker than others. Lack of protective equipment and greater exposure to people who are very, very ill.
So but these are all the more, these are all the more reasons why it's important to mobilize nationally. We've been hearing about the mountain ventilators, the tests, and so forth for so long, and yet it's so slow to get the results. And then, if this is a war, we ought to be acting like it's a war and mobilize. But I still don't understand, Dr. Ramon, if you may, one more time. If you woke up tomorrow with all the symptoms, would you go in for a test or would you not go for a test?
So the recommendations right now are, unless you are feeling extremely ill, having respiratory distress, or having severe symptoms, you should stay home. If you have a cold, if you have any of the standard symptom of without any kind of respiratory distress, you should be staying home. You should also call your doctor to determine what's best for you, but the general advice is stay home. They will not be just testing every single person that has a cold. And I think that that's been one of the big issues, is that when the test first came online, you had a lot of worried well going out and getting tests, which really are not going to be useful in terms of triaging patients who needs to stay in a hospital and who doesn't right now with the shortage of tests as we have it. So I could not agree with you more. We need to be mobilizing every resource possible to protect our precious resource of healthcare workers. We need masks, we need ventilators, we need all of these things. They need to be produced immediately. There shouldn't be any waiting on this. We are, as you said, in a war against a virus, and you have to act as such. When we dealt with this with Ebola, Ebola is so much more visually terrifying to people. I think people knew how to fight this. With this, it's a respiratory infection. It's harder for people to wrap their brains around. I think it took a much longer time than we anticipated to get to this point where we're now going to start seeing some of this major production. It's surprising to me as well, but now it's time is no longer the time to worry about what we haven't done, but what we're going to do now.
Okay, Dr. Ramoy, David Gergen, thank you both. And Dr. You'll be back to answer more of our viewer questions later this hour. Now, as cities and states order non-essential workers to stay home, the U.S. economy has been completely upended, and estimates indicate that millions of Americans now find themselves without a job. I'll speak to the former Labor Secretary, Robert Reich, next.
the network has to be prepared to absorb whatever it's going to come its way.
We're always prepared.
Make sure that the network is working all the time.
We're relentlessly committed to the network, so in times like this, we can all stay connected to work, school, and most importantly, to each other.
With type 2 diabetes, timing is everything. So why wait? Start Farxiga now. Farxiga, along with diet and exercise, helps lower A1C in adults with type 2 diabetes. Although it's not for weight loss, it may help you lose weight.
Do not take if allergic to Farxiga. Symptoms of a serious allergic reaction include rash, swelling, difficulty breathing or swallowing. Stop taking and seek medical help right away. Tell your doctor right away if you have red color in urine, or pain while you urinate, or genital area infection, since a rare but serious genital infection may be life-threatening. Do not take Farxiga if you have severe kidney problems, are on dialysis, or have bladder cancer. Other serious side effects include dehydration, genital yeast, bacterial infections, and urinary tract infections.